Okay, this is a med pack that I would use on a gun range. It's just set up for an emergency. If somebody happened to get hit in a firearms accident training. It doesn't have everything. It's really designed for bleeding control, and there's some airway things. It's just a simple Blackhawk Hydrostorm pack, and I attached a removable airway, and then my bleeding control is down here. On the inside I keep a BVM and a stethoscope and an Airway kit. But first, to begin with, I attached this to it. I took this from the Magpool videos. I think it's a really good idea, and it's just something that if you're not the one making the call, it gives clear, simple directions for someone else to make that call, especially if there's stress or if there's a lot of anxiety. They could follow simple directions on this. So I keep that attached. On the inside, water bladder in the back. This would be the Airway kit. In here I keep some Neosporin, a staph antiseptic. They say this is going to be good for MRSA, therefore it's very strong. It's going to be stronger than a regular. And I keep a Benadryl anti-itch if you get something that's going to cause a skin irritation. On the inside I got an alcohol prep and just a couple things. And here, because it's an Airway kit, keep gloves. I keep an antiseptic wash, athletic tape, see it in there, and then just a lot of 4x4s, and then just a real quick and simple place where I can keep bandages. I keep a triangular bandage in there and an ace wrap. And again, this is for the minor little cuts and lacerations you pick up when you're outside. This is probably going to get used more than anything else. You can pull it out, you can throw it to somebody, you can carry it. It's very accessible.
And then your small pouch here, what brand is this one?
This, for my Airway kit, you could use any pouch, anything that's going to be convenient for size for you. I chose this one because it has the exterior that I could actually stuff gloves in there, or the antiseptics like I mentioned. But this one is made by Tactical Tailor.
Oh, okay. It's mostly made in the USA stuff. You know it's going to work.
Yep. Good to go. Stethoscope, blood pressure cuff. The BP cuff isn't really going to be necessary, but if you're trained as a paramedic or an EMT, you're waiting for a transport, there's more information you can gather with a blood pressure cuff. Stethoscope is going to be much more valuable. If things are bad, carry a BVM. It's sealed, and in this it has a reservoir and a mask and the BVM itself.
And that's a respirator.
Yes, if you had to do mouth to mouth because it was a bad day, this would be the alternative. This is what you would actually prefer because you're not going to have any contact with that person.
Is that something that a non-paramedic can get their hands on?
You could buy those over the internet. You can buy them in a medical store. This is for Airway. It's detachable. I can take it and I can throw it to somebody.
Who makes that pouch?
This is made by ATS. Just folds out. And gloves, always a good thing. I carry a little face shield, a lot of alcohol preps. This is a Hemostatic Gauze. It's only one little sheet. It's probably not going to do a whole lot, but for a small little hole it could be rolled up and inserted into a wound.
That's sort of like a version of Quick Clot, except a different type, but a very thin pad.
Okay. NPA, and this I would use as I want to seal a wound on the chest. Chest has air moving in and out and I need to protect that. I need to close it up. I can use these little vena guards. This would be the same thing, it's just commercially made. And this is what the little vena guards look like. We use these when you start an IV and you tape the IV down to the person's arm. This has an adhesive people that are allergic to plastic tape, they would prefer this instead. So it's got a little window there that's covered in plastic film, and that's what I would use to close up a wound. I carry a few of them because sometimes things get contaminated, they get bloody, your hands are bloody. It's always nice to have a backup. NPA, OPA. This is for someone to help keep their airway open. You would utilize that with that BVM.
You have a couple of sizes there, one for yourself, that's sized for yourself, and then one general?
These are just common sizes. This would be a larger adult, this would be a medium-sized adult. 4x4s always, scissors. If I was going to block a wound on the chest, I would say I'm going to occlude that wound. I'd use that little Vena guard. This is something I could also use. I keep a needle decompression kit here, and all the contents are in there that I need. This is not something that a normal person would do without a certification or without proper training. I would be very cautious about doing this myself if I was off duty. I would have to have a good reason to do it and be able to back that up legally. However, I'm trained and I carry it if I need it.
Those look like some substantial EMT shears. Where'd you get those?
You can get these anywhere. There's cheap ones that are made, like if you buy them in China. They're not going to be very good. If you buy them and they're German made, they should be able to cut through a dime, cut through a penny.
And not be dead afterwards?
Yeah, they're good scissors.
What's the little hole there for?
You can actually use it on an oxygen tank to turn an oxygen tank on.
Oh.
So, just a quick and simple little kit for Airway. This would all be for temporary, but it could buy some time.
A Good Samaritan stuff applies to typical first aid, but if you start pulling out paramedic gear and just doing things you saw on TV, I don't think the Good Samaritan's going to go that far, so this should all be used by qualified people.
You should always have training, proper certifications. This would be my bleeding control. Again, I carry shears, and I keep these on a little lanyard that I can remove pretty quick. For very quick access, I have a SWAT tourniquet. I like these. I think they're very simple to use. For most tourniquets, you would have a difficult time putting them on yourself. This you could put on yourself very quick, very easy. That's why I like it.
What pouch is this one?
This is a high-speed gear, and it has little pockets in the back. You could use it to hold ammo. You could have it hold magazines like a dump pouch, or you can make it medical. That's what I've done. And in here would be a Mcmillan Tourniquet. This would be difficult to put on, or this is a SOF, I'm sorry. This would be hard to put on yourself. I could put it on you without a problem, but to deal with me, I would have some difficulties. If I put this on first,
that could stop the bleeding, give you time to do this one.
This would give me time to get this one on. That's all. Always carry gloves. I carry two different sizes on the bandages. One's a little bit smaller, one's a little bit larger. And you have different sized people. Hey, if I need to wrap something, I want to have enough of it. Always a lot of 4x4s. Flashlight if I need it for low light. Quick clot gauze. This is nice. You could wrap it into a wound, stuff it into a wound, and wrap it up tight to help control bleeding. Scissors. Always have a lot of scissors, and little tiny bandages. In the very bottom, I carry an emergency blanket. And I also have oral glucose. Always kind of nice to have. And that is about it. This does not detach. The whole thing is just a pack. You just throw it on your back and carry it in. Also have in this main pouch, I should have said that, a lot of times I'll carry little snack foods in here. I don't know if I have any at the moment, but it's a place that you can keep power bars.
And that's just part of the pack itself?
This I added in.
That's an insert?
Yeah.
Okay.
And I got this, it's a little ace gauge.
Oh, okay.
Yeah. But that's it.